Today's Live in the D is sponsored in part by Heart and Vascular Consultants, Metro Detroit's leaders in heart care and heart disease prevention.
It's Valentine's season, and there's a lot of talk about love these days. And when people fall in love, they often describe how their heart goes pitter-patter. But if you're experiencing fluttering in your heart, it may be something serious when it comes to your health. February is also American Heart Month, a time to focus on heart health, and our sponsor, Heart and Vascular Consultants, want to be sure that your heart is functioning as it should. We are joined by board-certified cardiologist, Dr. Delair Gardi. Good to see you in person, and thank you for being here.
Thank you for having me
Absolutely.
in here. I'm excited because last year it was on Zoom.
Yes.
So now we're seeing live.
Yes, which is nice.
We're excited.
So if people feel their heart flutter, what could it be, doctor?
You know, there's a lot of reasons for heart to be fluttered. The flutterings, these upper chambers are usually the cause. Okay. So what they do, instead of beating normally, they start to shiver, basically. So that fluttering feeling can cause them to feel uncomfortable, number one. And it could be a variety of things. Could be atrial fibrillation, which is the one that we worry about. Other things can cause a flutter, including supraventricular tachycardia, arrhythmias, which is less dangerous, but the important one is the atrial fibrillation.
So what is atrial fibrillation?
It's the synchrony, because usually the signal comes from the top part of the heart, travel to the middle, and then goes all the way to the ventricles. When it does that, the heart will pump up and then the lower part up. Usually the atrial fibrillation, these guys, they start to have erratic electricity. So it's going all over the place. So they start to quiver, like shiver, 300 beats maybe per minute. This guy here, the ventricle, won't follow as much, but this movement with the shivering is disorganized, not functional, make the heart lose some of the functional capacity.
That's a good way to put it.
Yeah.
That's what it is. And I like, that's a good way to put it. It's disorganized. That helps us kind of understand how it
Disorganized
goes.
electricity.
Yeah.
If you see electricity, it's all over the place.
Yeah, not a good thing. So is it serious?
It is serious. What happens is that if this left alone, the first thing about it, when this is fibrillating or just fluttering, the blood flow is stagnant and it won't go fast, so the blood kind of clot. If this blood clot, eventually, when you push the blood out and the heart starts to beat normal, this can be leave the heart, goes through the aorta, goes to the brain, goes to the kidneys, goes to the lower extremities, cause a lot of problems.
Like stroke,
and you name it.
Heart failure, cardiac arrest, I see all of that. So this is very serious, but then how is it treated?
The treatment is simple. You start with the blood thinners because you want to prevent the most important things, the clot forming and stroke. Other things can be treated by giving patient medication to slow down their heart rate, because the heart rate, if it goes fast all the time, is going to get tired like everything else. So you want to make sure that you control it. Sometimes you send patients for procedures called ablation. Well, they go through the groin and we ablate the naughty part, which is the dysfunctional, and then cure it. Sometimes not successful. But some of the people cannot take the blood thinners, and this is the important thing we want to talk about here is the state-of-art technology, where the clot is formed in the appendage, the upper part of the heart in here. We have procedures that we can plug it, and the patient does not have to take a blood thinners anymore with the plugger, and then they don't have to deal with the complication of a blood thinners or a stroke in the future.
Wow, impressive. Okay, so how can Heart and Vascular Consultants help patients?
There is a variety of service that we provide through an experienced team that's been here since 2007. From diagnostic procedures that we can offer to the patient to the treatment and every aspect you think in the heart and vascular. Since we treat vascular too, you can think about it, hey, you have peripheral artery disease we can treat, even new technologies with the TAVR, which is aortic valve replacement, Watchman, and other things. So we're here for you folks.
That's
anytime.
Awesome.
You think heart, think about heart and vascular.
That's right. This is who you need to talk to. Thank you so much for being here, Dr. Gardi. We appreciate it.
Thank you.
To find out more about all that Heart and Vascular Consultants can do to help you have a healthy heart, visit their website, hvchealth.com. Again, that's hvchealth.com.